everybody, my name is Dr. AUSTINBLANCHON, and in today's video you're going to see a chiropractor do a reaction video. This chiropractic video is called Severe Ankylosing Spondylitis Painful Chiropractic Cracking Adjustment. This is from Dr. Joseph Cipriano, the Y-strap doctor on YouTube. In this video I'm going to go over the adjustments and typically just do a reaction. So let's get to it.
I want to see how you lay back this way. Try to keep the knees and legs off. Alright, so we're about right there.
Yeah.
With going.
Now, you are seeing this patient lie on their back, and you can tell there's a big, huge rounding of this person's spine. This person doesn't seem to have mobility in their spine. Now, I'm going to get to with the definition of ankylosing spondylitis, and we can potentially find out how this patient got ankylosing spondylitis. What is ankylosing spondylitis? Now, this is a chronic inflammatory condition that primarily affects the spine. One of the hallmark signs of ankylosing spondylitis is that you're going to see fusion, or these bony outgrowths, in what is called the sacroiliac joint. This is where your butt and your back dimples are, in the very lowest portion of your back. Now, what does ankylosing spondylitis manifest in the body? It's typically a lack of mobility in the spine. Some common symptoms are as follows. You can get stiffness in the spine that gets better with movement but gets worse with rest. You might wake up with morning stiffness in the spine. Other things, because it's an inflammatory issue as well, you might have other issues related to your eyes, potentially called uveitis. Now, other things that might be manifesting in ankylosing spondylitis is that because it is an inflammatory issue, how you get a workup to see if you actually have ankylosing spondylitis is that it's typically you get some x-rays and you might get some blood work. Now, some of the blood work that might be done is called ESR, CRP, and you might get a gene tested to see if you're positive for this gene called HLA-B27. What you might see in those x-rays is that towards the very bottom of your lower back, the sacroiliac joints, you might get those bony outgrowths that look as if they're poking out. That is where some of the stiffness and the progression of this ankylosing spondylitis is going to be happening. Various different therapies for ankylosing spondylitis does occur. There's specific anti-rheumatic drugs that a medical doctor might prescribe, recommended for physical therapy and posture-based mobility exercises, as well as chiropractic care. Chiropractic automatic flexion distraction technique is something that I have used with some patients with ankylosing spondylitis in my experience. So now, let's get back to the video.
Right. Yeah, right to there. With this is going to be one of the only things where you're going to get any relief from. Because even though a lot of the other techniques, when your body's already fused, it's just not any.
So, I'm sure you're wondering, what is this contraption that this chiropractor is putting this patient in? So it seems that this chiropractor is elevating their table so that it's going to support more of the patient's spine. As well, he's adding what is called the Y-strap to this patient's skull area and to the mandible, the jaw area. Now, my guesstimation is that this chiropractor is trying to elongate the spine. Now, we haven't seen this person's x-rays, so we don't know how much fusion is actually in the spine.
Just relax.
Yep. Now, that goes to the clip. The chiropractor is standing on the table just to get and to reach the angle of where the patient is at. That is how severe this person's ankylosing spondylitis is.
The first few years it was mainly my back, but here lately it's gotten up into my neck really bad, and my hips. My hips probably the worst.
Okay.
Just trying to, sit down for a while. I'll go stand up. And oh God, this ankle
Yeah, so this patient with the ankylosing spondylitis was talking about how he notices most of the stiffness into his hips. So that is a hallmark sign. Going from sitting to standing is going to require a lot of hip mobility. And in this person's case, his hips, which is his pelvic region, which is also his sacroiliac joint region, seems to be very, very stiff. Now that could be because his bones are starting to fuse together.
I've let it get worse than I should have. I should have done something about it a long time ago. But
How long ago did you find out?
I would say I first started noticing my posture getting bad around 18, 19.
Okay.
So this patient said that he has started to know that his posture was starting to get bad around 18 or 19 years old. Typically, from what I believe from some of the scientific courses that I've taken, a lot of people with ankylosing spondylitis, they're more males and they will notice it in their later teenage years. So this is really a classic sign of the ankylosing spondylitis symptom presentation.
But I didn't go to a doctor until probably 2009, 2010.
Gotcha.
And that's when he did some x-rays and showed me I was fused together in a few places. And he said, you know, what you have is ankylosing spondylitis. And I haven't done anything since then.
Gotcha.
So it's been...
Now, what this patient was saying, he was diagnosed with it based off of the x-rays. I'm sure there was some blood work done because you want to see some erythrocyte sedimentation rate. So you want to see how the red blood cells are trickling down into the bottom during a test because that is a signal of inflammation into the bloodstream. What this person did say that he has not done anything, which that's most likely what was not recommended. This person was recommended to have an intense focus on physical therapy and posture-based exercises. This person could have potentially altered how severe this ankylosing spondylitis has progressed to if they did very soon after that. If they really knew what to do, they would do some physical therapy in conjunction with some chiropractic care as well as hire a personal trainer. All of those things absolutely, potentially could have helped this patient.
So I know, even like you're saying, I just want to see how much rotation looking to each side you've got. Pretty tight right there. Pretty tight right there. Yeah, a little bit more there, but
yeah, a little more to the left. The right is just worse.
This chiropractor is doing a range of motion testing to see how well the patient can turn their head to the right and towards the left. And it seems that that patient has a really tough time absolutely voluntarily moving their head, which means that their quality of life is 100% reduced.
It's worse.
What about bringing like an ear down?
Yeah, none of that.
None of that.
None of that.
Now, this person can't laterally bend towards the side, so they cannot move in this direction, which means that there's definitely an inability and inflexibility in their spine. He had barely any range of motion turning, and pretty much no range of motion at all tipping your head. And you can see, I can tip my head all the way pretty much my ear to my shoulder. This person couldn't even bend like that. I could not even imagine. I feel for this person. This is a very tough condition, and you really wonder what's going on. I've heard lifestyle factors could be playing a role, some hereditary aspects could be playing a role with this. It's very unfortunate.
What about looking down? What about looking up?
That's about it there.
Okay.
I feel tight somehow.
Okay, so neck very limited.
Right.
Now, this person barely could not even look up at all, and it seems like his back muscles were about to spasm and he was about to go so far up. So this person has to use their eyes, and that's all they can really see, so they can't do things like watch the clouds, look at the birds, so he really can't move much, and something really, really needs to happen.
Right.
Now in the low back, if you bend forward.
Oh, yeah, I mean, it's... the leg's pretty good.
Is it? Did
Now, so what is interesting is that he was able to use his lower back joints in what is called flexion as he was bending over to touch his toes. He had more range of motion in his lower back than what he did in his upper back.
go back? Let's see.
Yeah, that's about it, bro.
Okay.
Yeah.
Now, when the chiropractor is asking him as he's standing up to arch his back, he could not even move at all. His middle back, his thoracic spine, as the rounded spot, it didn't even move backwards at all. So he really cannot be upright. This patient was talking about how he has been to a chiropractor, and that chiropractor was saying that, hey, you're not really moving really right, this is really hard to adjust. And that chiropractor at that time didn't know that he had a diagnosis of ankylosing spondylitis. If I'm thinking in that chiropractic standpoint now, it's going to take quite a bit of time to see some changes. You're not necessarily going to see very quick changes in this person's case because of the severity of his stiffness in his spine compared to other people that don't have this condition that can benefit from chiropractic even just after one adjustment. This person can definitely have an impact with these adjustments, but will need a ton of other lifestyle factors, lots of stretching, lots of physical therapy, lots of mobility exercises. It will take a lot of dedication on this person's part to really want to actually change his quality of life. Now, that's not the best sign that the patient is trying to go onto his stomach on the table, and the patient is starting to get cramping in his back muscles, and he really cannot fit on the table because he is so rounded. It looks like his collarbone region in his upper chest isn't even touching on the table due to him being so stiff. So the treatment itself will be a challenge due to the patient not even being able to conform and lay down on a table.
So we're about right there.
Yeah.
With going back. Okay. Just want to see.
Now, the chiropractor was testing. He's trying to find a comfortable position for the patient, which it is a struggle, as you can tell. This patient can't even lie on his stomach and really cannot even lie on his back. So there's definitely very limited ability to really do anything with this patient if you're only going to do things on a chiropractic table. So this chiropractor is going to have to get pretty creative, which I'm sure other healthcare professionals that have assessed this person and tried to treat this person has run into some difficulty.
Oh, yeah.
Now, this chiropractor was trying to do a cervical adjustment for this person's neck in a seated position and what we call a pull adjustment, where the chiropractor is standing in front of them, placing their hands by the back of the joint, trying to increase the rotation ability of the neck, and you can tell immediately that patient was grabbing his head and not in comfort, because if the body doesn't want to move, it really doesn't want to move. It's tough. This chiropractor is trying to help, but you can tell that really flared it up and aggravated it.
Oh shit.
Now it's a really tough one. That chiropractor is trying to make the joints move, but you can tell that person is in a lot of pain. It doesn't really seem to be comfortable, and it does not want to move. So that chiropractor is in a tough position. You're going to have to alter your techniques. You're going to have to do different chiropractic techniques and use different amounts of knowledge that you have to help this person.
Bring your hands on top of mine. Good. Alright, so I want you to, I'm going to have you trust fall back under me. I want you to also squeeze your whole self together. Yep. Alright, fall back, fall back.
This chiropractor is doing a standing thoracic adjustment to try to help allow this person to be more upright. And you could tell it was pretty uncomfortable for the patient. It didn't seem like there was much movement that was occurring during that adjustment. And that would be a very tough adjustment for that specific person. I wouldn't have expected much to happen with that adjustment. What I believe this patient could need, now this is just based on education standpoints, I didn't fully assess this person. Now, to help change the structure of ligaments that go from bones to bone, you typically need a longer stretch so that the body can signal that stretch and actually stretch the ligaments to restructure the ligaments to decompress this person's spine. I would want to do more physical therapy stuff where you'd be doing longer holding stretches as long as this patient can tolerate it, which it can be tough. I would do posture exercises. There's techniques called LDOA, E-L-D-O-A. That's one technique I would try on this person. They're posture-based stretching exercises. Also, I would try dynamic neuromuscular stabilization exercises. And from a passive standpoint, I would be having traction tables do a lot of the computerized pulling to help open up the spine in a gradual manner. Now there's another machine, it's called shockwave therapy. Shockwave therapy puts thousands of shockwave impulses into the body, and I believe that shockwave would probably help to accelerate this person's stiffness levels to be reduced. This patient is now on the right side down, and this chiropractor is going to be working on the very most up portion of the cervical spine, and I didn't feel what this chiropractor was feeling, so it seems that he's working on some of the highest most bones of the cervical spine. There's the first and the second cervical bones called the atlas and the axis, and I believe he's working on those bones, and these bones are very important bones of the body because they're so close to the brainstem. I know that adjustment looks very interesting. It pretty much looks like he's just karate chopping the spine. Now, I have done this technique a few times in my career. Some chiropractors do this technique a lot. It's really hard to tell in this person's case if it's going to make a whole lot of change for this person. Sometimes you can feel this between your jawbone, your ear, you feel this little divot, and you might be able to kind of touch the most lateral portion of the bone. It's called the transverse process, transverse for running horizontal, process of these bones. That chiropractor is placing their pinky side bone hand in that bone, really trying to push it back to the center. Now this person is still on their side, and the chiropractor is now trying to adjust this person's lower back, trying to increase motion in the sacroiliac joint, which is a common spot for people with ankylosing spondylitis to have a lot of stiffness in the spine. These sorts of adjustments are trying to increase the range of motion of that area and helping to relieve any aches, pains, and stiffness. Now this looks like a very interesting contraption that this chiropractor is putting in this patient. He's trying his best to get stuff to stretch and to move. This person is obviously very rounded on the table. Their head can't even come down to the table, which, to be honest, try this. Lie on the edge of your bed and see, with your legs dangling off, if your back can just go flat. It most likely can. So if you could imagine how stiff this person's spine is and how stiff their body and potentially how limited their life is, then we can all have empathy for this person. And this chiropractor is using his Y strap, which is just grabbing onto the skull and taking it further away from the tailbone just to help distract and open up the joints of the spine.
Okay, breathe, breathe, breathe. What did you feel?
Oh, I definitely felt something there.
And the chiropractor asked the patient, what did you feel there? And the patient was like, oh, I definitely felt something there. Now, it didn't look like really much movement happened at all, but this person has a fusion in their spine, so it's not going to move very much. So the goal of this adjustment is to stretch the area. Stretching can cause some discomfort to be relieved. You do that whenever you rub on your elbow, if you bump it, or if you have some muscle pain, you typically try to stretch it, rub it out. That's what this chiropractor is in general trying to do, is what it seems.
Oh.
Now that chiropractor completely stood up on the table and gave it one last jolt, and then the patient immediately was... I feel for that person because people are trying to get things to move, and then his body just doesn't like it. So you can see as to his body was really trying to stiffen up over the years, if not decades, because I don't know how old he is, in that when people are trying to help treat it and trying to do what they think is best for them, you can tell it's very uncomfortable for this person. That person is not able to fully let go. From a practitioner's standpoint, when you're trying to help manage whatever's going on, I don't believe you're able to really fully treat this person. You can't reverse time and go back in time and really find out what was the cause of this. You do have to be very cautious with what you're doing, but try not to cause discomfort. You don't want to cause any harm to this person.
That's right, you good. That's a big movement.
Yes, sir. This is the main part of my back. I feel like it's like that. I've definitely felt those bones going up like that. Going straight up, yeah, for sure.
So this patient was saying internally he could feel how those bones were going up. He can kind of feel them go. That was the joints on both sides of the spine. Releasing, or at least gapping in and having a very quick stretch, so that he did open up some of the joints. And when the joints get a very quick movement, this has a rebound effect, signaling to the brain that there is movement occurring, and this can help with the flow of fluid distribution in and out of the joint, which is typically good, but my guess is this patient was probably pretty sore after the adjustment, and probably is going to be sore for potentially a few days.
I think my blood's circulating a little bit better, you know.
Good.
Yeah. Wow.
Good. I mean,
Sounds good.
Now that patient was saying, you know, I do feel a little bit better. I do feel a little bit better. Which, for the most part, in my career, pretty much always get people feeling better. Pretty much most of these chiropractors do. You typically will feel a little bit better. Now, a lot of this is because human touch is very powerful. Getting hands-on body work is very important. He's seeing a professional. He's trying to build some trust, and he's trying to take care of his issues and resolve whatever's going on. So that takes some courage and some effort. And so when things are done, you typically feel better about yourself for actually doing this sort of thing. So this person says they feel better. And it does look like he's not as hunched. So those adjustments, trying to pull his head backwards, you know, some of that, it definitely had an impact on his body. He's probably going to be sore. He's probably going to be a little more upright temporarily. Alright everyone, that is my chiropractic reaction video of the severe ankylosing spondylitis, painful chiropractic cracking adjustment by the Weistrap doctor. If you're interested in more chiropractic reaction videos, you can look in the description of this video and you will see plenty more of them. Now, my name is Dr. Austin Blanchon, and I'll see you in the next video.